perform a couple of motions here at the wrist. So first we're going to do wrist flexion. I'm just going to bring your arm up over here so that your hand is hanging off the edge of the table. For wrist flexion, you're just going to bring your hand down and just keep your fingers relaxed as best you can. I'm going to line up my goniometer. Go ahead and relax. My axis of rotation at the triquetrum, my stationary arm in line with the shaft of the ulna, and my moving arm along the base of the fifth metacarpal. So go ahead and perform that motion for me as far as you can. And we are getting 69 degrees, and normal here is 80. The next one is going to be extension, so we're going to just the opposite way, bring your wrist up. And same landmarks here, relax triquetrum, shaft of ulna, and fifth metacarpal. Go ahead and bring that wrist up as far as you can. And we are getting 61 degrees, and here normal is 70. The next motion we're going to be doing is ulnar and radial deviation. So I'm going to have you bring your arm back, keep that hand flat, go ahead and just relax. And I'm going to, for both of these measurements, my goniometer is going to be lined up at the capitate for my axis of rotation, my stationary arm bisecting the forearm here, and then my moving arm is going to be along the third metacarpal. So for ulnar deviation, you're just going to bring your wrist out towards that pinky side as far as you can. Wowzers. Norm, right here we are getting 61 degrees, and normal is 30, so you have some excessive range of motion there. Next we're going to be doing radial deviation, so same thing except towards the thumb side. I'm going to go ahead and relax. I'm going to line back up my goniometer at the capitate, forearm, and third metacarpal. Go ahead and bring it to the thumb side. All right, and we are getting 23 degrees, and their normal is 20 degrees. So that's all the ones we'll be doing in sitting. Next, we're going to have you lay on your back, and if you don't mind removing your shirt so I can see all the landmarks on your shoulder, please. All right, perfect. So the first motion that we're going to be performing is shoulder flexion. So you're just going to have your thumb up towards the sky and bring the arm all the way up as far as you can. Perfect. Go ahead and relax. I'm going to line up my goniometer axis of rotation along the greater tubercle of the humerus. My stationary arm is going to be along the mid-axillary line, and my moving arm is going to be the lateral epicondyle. So go ahead and perform that motion for me. And we are getting 178 degrees. Normal range of motion there is 180 degrees. Next, we're going to be doing shoulder abduction. So palm up and going to be going all the way around as far up as you can. Perfect. Go ahead and relax. And I'm going to line up my goniometer's axis of rotation to the anterior acromion, stationary arm parallel to the sternum, and moving arm again, this time to the medial epicondyle. So go ahead and perform that motion for me again. I'll line up my goniometer. All right, and we are getting 171 degrees. Normal is 180. Next, we're going to be doing elbow flexion. So I'm just going to put this towel here for now. We're going to have you bring your hand up in flex position. Perfect. Go ahead and relax. I'm going to line up my goniometer, axis of rotation at the lateral epicondyle, my stationary arm up to the acromion, and my moving arm is going to be the radial styloid. So go ahead and perform that motion for me again. Perfect. And we are getting 150 degrees, which is exactly normal. And then for elbow extension is where I'm going to use the towel here to make sure that we can get through that full range of motion and the table's not blocking you. So just start from a flex position. I'm going to line up my goniometer again, axis of rotation at the olecranon, stationary arm up towards the acromion, and my moving arm will be at the radial styloid. So go ahead and perform that motion again for me, straighten as far as you can. And we are getting 8 degrees. Normal there is 0 degrees of elbow extension. For the next motion, I'm going to have you scoot towards the edge of the table for me a little bit. And I'm going to bring your arm out to 90 degrees. I'm going to support your humerus with the towel there. And we're going to be doing internal and external rotation. So for internal rotation, you're going to bring your hand down towards the table as far as you can without compensating and bringing that shoulder up. So go ahead and relax. I'm going to line up my goniometer axis of rotation at the olecranon process. Stationary arm is going to be perpendicular to the ceiling, and my moving arm is going to be that ulnar styloid process. All right, so go ahead and bring that hand down as far as you can. All right, and we are getting 61 degrees. Normal here for internal rotation is 70 degrees. For the next one, we're going to be doing external rotation, and we're going to have you bring your arm back as far as you can. Perfect. Go ahead and relax. And same landmarks, olecranon process, perpendicular to the ceiling, and ulnar styloid. Go ahead and bring that arm back as far as you can. You do a little bit more, you think? Perfect. All right, and we are getting 79 degrees, and normal there is 90. Thank you.
Okay, I'm just going to shine the light into your eyes. Great, when people react. Great, people's reacting. Great, so I'm going to do it from the scar. Great, combination is good. I'm just going to check your ears. Good. And both your eyes and your ears look symmetrical. Your eyes are round as well. Everything looks equal. Now I just need to check into your mouth, your lips, your tongue, and your teeth. Open up. Thank you. Good. Teeth look good. Mouth, tongue, and your lips look pink and moist. The next thing I'm going to do is just check your arms and your fingers for capillary refill. Okay, just going to check the capillary refill. Good return, 2 seconds. Good return, 2 seconds. I'm just going to check your arms for your temperature. Good, nice and warm and dry. Good. I'm also just going to check your head. I'm just going to put on some gloves. Do you have any openings or anything I should be aware of on your head? Nope. Okay. Good. Neck look good on this side, just going to go around to the other side. Good, your head and neck look good. So I'm going to dispose of my gloves and just wash my hands again. Okay, I'm now going to just have you press my hands. Good grip, strong. I'm also going to have you push away. Good, and pull forward. Yes, perfect. Now I'm just going to have you raise your arms up and do range of motion. So up, down, great, side to side, and around to around. Good range of motion. I'm now just going to have you close your eyes, and I'm going to have you recall what fingers I am touching in what hand. Okay?
Left pinky.
Good.
Right thumb.
Good.
Left middle. Right pointer.
Good sensation. Good. Everything's good. The next thing I'm going to do is just check your radial pulses. Good. Both equal and strong. Good. The next thing I'm going to do is check your chest. Are you okay with that?
Yep.
Okay. Good. Your chest looks like your skin is intact. Great. Just going to check your skin trigger. I'm going to do a little pinch. Good. It bounces back. Skin is dry. Great. Next thing I'm going to do is listen to your heart and your lung sounds. Let's slip on and do that. and listen to your lung sounds, okay? I'm just gonna have you breathe in and out through your mouth. If you get dizzy at all, just let me know. Okay, I'm gonna have you sit forward and I'm gonna listen to the back of you. Great. Lungs are clear bilaterally. And the next thing I'm going to do is just check your apical pulse. I'm going to locate your apex of your heart by checking on your skin to the fifth intercostal and clavicular. 1, 2, 3, 4, 5, and then clavicular. So I'm going to listen for 1 full minute, okay? Great. 84 beats per minute. Rhythm was good, and normal rate as well. I'm now going to check your abdomen. I'm just going to lay you back, if that's okay. Okay, I'm going to first check your skin. Everything looks good and intact. No scarring, no openings. Now I'm going to auscultate, listen to your bowel sounds in 4 quadrants, and then I'm also going to lightly palpate, and you let me know if there's any pain. I'm just going to lower this. Great. 4 active bowel sounds, and now I'm just going to lightly palpate, okay? Any pain? Good. Abdomen is soft, not distended, and small. The next thing I'm going to do is just work our way down, so you can raise the blanket up so I can see your legs, and if you want to cover your top, that's fine. I'm just going to check the skin front and back on both your legs. If you could just lift for me. Great. As well as this one. Great. Skin is intact, no redness, no openings. Just going to feel it through touch, the warmth. Great. They look warm. Good. Both look equal. And both are warm and dry bilaterally. Now I'm just going to check your pedal pulses, as well as your posterior tibial pulses. Good. Both strong and equal. Good. Both strong and equal. Next thing I'm going to do is just have you flex your legs and your ankles and your toes and your hips just gonna lay you back a little bit. Have you do range of motion of your legs. Good. Good. If you can bring them outwards too. Good. Good. And if you can move your ankles and your toes. Great. Good range of motion. Next thing I'm going to do is just check your capillary refill on your toes. return. 2 seconds on that. Good return. 2 seconds on that as well. I'm going to have you close your eyes and I'm going to check your toes and you tell me what I'm touching, which foot and which toe.
Pinky on the left. Big toe on the right. Middle toe on the left. Middle toe on the right.
Good recall and sensation. Now I'm going to press on your feet and have you press them onto my hands. Good, strong and equal. Okay, I'm just going to wash my hands now. And I'm going to clean my equipment as well.
There's definitely some concern there. We're going to say for the sake of the video that Teddy's ears are on the side of his head. So the first thing I want to look at for his ears is placement. It should follow a direct line, a horizontal line from the outer corner of his eye to the top of his ear. So his ears should have fallen about here if he was human. And then you can also turn that perpendicular and that should be the, this way here, showing the ear placement. And the other thing we want to do is we just want to inspect the ears overall. We want to make sure that the helix, all the skin is intact around the helix, and that the crus inside has the fold, it's not smooth. And with that being said, we want to make sure we look at both the left and the right ears, not just one side. So then we'll go ahead and we'll turn Teddy this way, and we want to look at eyes next. So looking at his eyes, he is awake and he's looking at me, which is perfect. We're going to pretend I have an ophthalmoscope. I don't, but we would be looking at his red reflex. I see his red reflex is present in both eyes. And then I also want to take a look at his cornea to make sure that there's no cloudiness, which there's not, and there's no discharge or anything like that. We also want to check the position of the eyes to make sure that they're horizontal and that they're not spaced too widely apart or facing down or facing up. They should just be in a straight line, which his are. Moving on to his nose assessment, we want to make sure that his nares are patent. I've asked Mom already if she's seen any signs of respiratory distress, such as noisy breathing when he's being bottle fed or when he's crying, and she said no. So using my pen light, I just want to go ahead and take a look inside of his nose, comparing both sides, and I can see that his nares are patent. Moving on to mouth, I already have the pen light, so that's perfect. I can look at his mouth and I can see that there's no abnormalities in the outside of the mouth. There's no cleft. I can see when he opens his mouth that he can lift his tongue up and push it past his gums. We'll go ahead and put gloves on at this point, because what I want to do is I want to put a finger inside Teddy's mouth and I want to feel the palate. So first the hard palate and then the soft palate in the back. His is smooth, there's no abnormalities there, and I can see that his gums are pink and healthy and moist, so that's perfect. And then we're going to go ahead and we're going to turn Teddy so we can look at his neck. So we just want to check for any webbing there at his neck or any kind of extra skin folds or anything like that, and I don't see that on him. And then moving down to his clavicles, we want to make sure we palpate the clavicles, running our fingers over both sides. We want to make sure that they're smooth and that there's no step-offs or crepitus or anything like that from birth. And then moving on, we can do chest, we can do cardiac. So chest, I can see that his chest is flat, which is good. For cardiac, we want to make sure we're listening for the full minute, because newborns have a tendency to sometimes stop breathing. And so we're going to do that, and then also listen with both the diaphragm and the bell side. I'm not going to put this on because I want to show the placement of where I'm going to be putting my stethoscope. So I'm going to lift Teddy up too so we can see. But we would be doing, we would be listening at aortic, pulmonic, tricuspid, and mitral. And then same thing, turning it around and listening in those 4 spots again for the full minute. We should hear S1 and S2 heart sounds, hopefully no murmurs. I don't hear any murmurs on him. And his heart rate should be, for a newborn, about 120 to 160 is normal. So we'll lay Teddy back down here. And then since we already have our stethoscope out, we can go ahead and we can listen to lungs. First, of course, assessment, looking at his breathing, and I can see that he's not in any kind of respiratory distress. He's breathing normally. Normal respiratory rate for an infant is about 30 to 60 per minute. And we want to make sure we listen both anterior and posterior for him. So I'm going to, again, lift him up and just for demonstration purposes, show where I would place my stethoscope. Right here, here, and then down, and both on the other side as well. And then we would turn Teddy over to listen posterior. Move those ears, those big ears. 1, 2, 3, 4, and again listening for the full minute for respiratory rate. And we'll go ahead and put our baby back down. And then the next thing we're going to do is abdomen. So again, starting with inspection, I want to see that his abdomen isn't distended, which it's not. His umbilical cord looks healthy. I don't see any kind of protrusion with it. If there was a protrusion, I would do a palpation and just check for if there's any firmness or hardness there. The next thing I want to do is listen to bowel sounds before I do any kind of palpation. So same thing, we're going to listen with our diaphragm side, and I'm going to lift Teddy up so you can see that I would be listening to his bowel sounds here. Great bowel sounds, normal active bowel sounds, which is good. And then putting him back down, I want to do my palpation of his abdomen. So that's going to be one hand over the other, and we're going to do a palpation there. On the right side, I want to palpate his liver. It should be about 1 to 2 centimeters below the right costal margin. And then just making sure that I'm not feeling any masses or anything like that. His abdomen should feel soft, and it feels soft, so that's great. So then I'm going to go ahead and we're going to turn Teddy.